to another episode of Local Expert Interviews TV. I'm here with Ope from London Periodontics and Implant Centre, and today we're going to talk about something that not many people, including myself, know much about. So, hello Ope.
Hello James.
So yes, the topic we're going to talk about today is periodontics. What is periodontics is obviously a great question, and I think, in fact, let's go straight to Ope and say, Ope, what is periodontics?
Yes, I agree that the science of periodontics can be quite esoteric. Put simply, it's the study of the supporting structures of teeth. And the reason why it's important, I like to say to my patients, is that you can, like most patients, they want a beautiful smile. I want a beautiful smile. But if the foundations of that smile aren't solid, aren't fully understood, or if you've got termites, for example, in the foundations, then it wouldn't take very long for that wonderful, beautiful smile that has been reconstructed to fall apart. And that's why periodontics is important. It started about 100 years ago in the US, and I'd say the first periodontal practice, specialist periodontal practice in the UK, was established in London in the late 70s, early 80s. So we have been around for a while. The remit of periodontics has expanded, though, from just the study and the management of the supporting structures of teeth to implant dentistry, because primarily periodontics historically was a surgical specialty, and implant dentistry just fell quite nicely into periodontics on one or two other specialties.
Okay, fantastic. I mean, Ope, you talked there about the foundations of the teeth, and as a let's say a consumer or a patient, or even myself, I don't see the foundations of my teeth. I don't know what they look like. How do I know if I need to see a periodontist or even a dentist?
Yeah, that's a great question. Unfortunately, periodontitis doesn't hurt, and that's the not unfortunately, but the one reason that would prompt most patients to go and see a dentist is if there's pain or if something breaks. But the primary thing that tends to happen to a lot of patients is actually bleeding gums, and I would suggest that if that happens, that you at least go and see your general dentist. There may not be a periodontist in the area, in your area, so at least go and see a general dentist and not ignore bleeding gums, because in some patients that simple bleeding gums could lead on to something more serious from a gum perspective in the long term. The other things to think about are your gums receding? Do your teeth look longer? Are the gaps between your teeth getting bigger? Are your teeth, particularly if your teeth are also becoming more sensitive, perhaps to hot and cold drinks? Unfortunately, a lot of my patients come when the teeth have become loose, and that tends to be more of a late sign of periodontitis, so this is gum disease. But even for those patients, there are newer techniques that can help retain those slightly loose teeth for longer. So those are really the primary signs that patients should be looking for.
Okay, fantastic. So let's say then I or anyone out there notices that they have bleeding gums, okay? And so what three things should I look for if I'm looking for a periodontist to go and visit?
Yes, great question. The first thing to ask yourself is this person a specialist? And a specialist is a legally protected title in the UK, reserved for that cohort of dentists who have demonstrated expertise in periodontics, and it's got through a series of structured training programs over 3 to 6 years. There aren't that many of us, so not everybody needs to see a periodontist. So the next question is, if I can't see a specialist periodontist for whatever reason, can I see a dentist with a specialist interest? So people who've got master's degrees from the various universities. Also, other colleagues who have gone on shorter courses would have gained useful knowledge and insight into the science of periodontics. Those are the things to think about and ask when you actually go and see the dental professional.
Okay, so that, you know, obviously you need to check whether they're, I think, did you mention the specialist list, the specialist periodontist list?
Yes, this is a list kept by the General Dental Council, which is our regulator, and it's very closely guarded for dentists who have demonstrated a certain level of expertise in the science of periodontics, and today in implant dentistry as well.
Okay, so so I've taken that advice on board, and now you know, I'm going to visit a periodontist. You know, let's say I know you're in the Knightsbridge area. Let's say, you know, we have a look for a practice in your area. What three things makes your practice different from others in the area?
Yes, we tend to want to have a relaxed and friendly atmosphere. So all of us are, for example, are on first name terms. Our receptionist, who is the first point of call, Jessica, is absolutely fantastic. She's one of the friendliest people I've ever come across. And even on a particularly bad morning or stressful morning, all I need to do is go downstairs and have a 10-second chat with her, and you're relaxed. And as a result, we also want our patients to communicate that with our patients, and our patients to actually feel that they are part of our practice. Because I truly do mean this when I say, on behalf of all of us, that we want to ensure that anybody who comes into our practice truly understands the care and attention that we bring to them. In addition to that, of course, the clinical skill and expertise that will be brought to bear in the actual management of your condition, in my opinion, would be second to none. And that whole package will lead to great outcomes.
Okay, so, you know, somebody has, so, you know, you mentioned some key things there. Can you, you know, tell me exactly what would happen if, you know, someone would walk through your door? You talked about, you know, they'd meet your friendly receptionist. Can you tell us exactly, you know, from the treatment aspect, what would happen?
Okay, it depends on how they've got to the practice. Primarily, a lot of our patients come through referrals from local general dentists, and that they would have already sent a significant amount of information about the patient, their concerns, particularly what they're bothered about, because those reasons for the referral and those motivations of the patient really do dictate the treatment plan, because there are various options available for our patients. If a patient has, so initially there'll be a consultation really for everybody, and if I already have that volume of information, that's usually enough to generate a treatment plan and estimate of fees for the patient, which they will receive before any treatment starts. For some patients, also referred patients who have particularly complex problems, we may need to see the patient for a second or perhaps a third review appointment, just to ensure that the treatment plan is right for the patient. And this is as much of getting to know the patient part of the phase of treatment as the patient also getting to know me, and we're all understanding each other, so that we're both clear on what the final result is even before we start any kind of treatment. Some patients also get refer themselves, sorry, and sometimes they need one or two consultations before we start, but everybody receives a consultation before we start.
Thank you. I mean, you know, thank you very much, actually, Ope, for coming on and sharing all this information. I mean, you've covered a lot: periodontics, bleeding gum, periodontitis, and, you know, how the difference between specialists. So is there anything else any other advice that you could give to the users out there?
Primarily, don't ignore bleeding gums, because the earlier it's managed, the better. And I say to all my patients, no matter how bad you think it is, chances are I have seen a lot worse, and the solution for most patients tends to be relatively, there is a solution for most patients, if not all patients. If you're thinking about having teeth removed for dental implants or having dental implants placed, it's also important to think about how those dental implants are going to be maintained over the long term, which is also within the remit of periodontics. So seeing your local periodontist would be a useful port of call before you embark on any sort of treatment. These days, some patients like to have their gummy smiles corrected, have to have their recessions, so their receding gums also corrected. There are techniques available to manage both those conditions successfully in a lot of patients.
Great, that's some fantastic advice. So I think what I take from that is, if you are looking for that perfect smile, then think about your foundations. Think about, you can't just go straight away and go and have the Hollywood smile. You have to think about everything first, and then build on that. Is that correct, Opie?
Absolutely, that is spot on, and it is possible to have both a healthy set of gums and a fantastic Hollywood smile, if that's what you want.
Well, fantastic. So, Opie, once again, I want to thank you for coming on today.
My pleasure.
And I also want to say thank you to the viewers for watching. And I'm going to leave Opie on the screen there. And if you have any problems, whether it be bleeding gums, or you're actually worried about something, then I'm sure Dr. Opie and his friendly staff will be able to point you in the right direction. So once again, thank you very much, Opie, for coming on today. And to all the viewers out there, we look forward to seeing you on the next episode of Local Expert Interviews TV. Thank you.
Thanks for having me.